I'm Professor Jules Forder. I'm the Director of PSSRU at the University of Kent. Well, the most obvious thing, I guess, is certainly grown in size. I think we've diversified a lot as well, so cover many more areas. Certainly increased in sort of breadth of techniques for analysis, research methods and so on. And I guess we're much better at engaging with our customers, with the public, than we perhaps were in the past. Fondest memory? Well, I guess actually my fondest memory is probably as a junior researcher, just having the freedom to do this kind of research that I was most interested in. Obviously it gets a bit more constrained the more senior you are. So yeah, it was a good time just to have that freedom to really look at stuff that you're interested in and try new ideas. Well, I guess most of my interests lie in organisation, finance of social care, economics of social care. More recently looking a bit more at outcomes and quality in social care. And a bit on health and social care integration, those sorts of issues. So still pretty broad within the field, I'd say. I don't know about most proud of, but certainly the most exciting was the time when we were working on financial reform, and some of that work involved briefing of pretty senior people. So briefing of Chancellor was quite an interesting time. Meeting the Prime Minister at the time, Gordon Brown, was also quite an interesting thing. So I'm not sure we're proud of, but it was certainly interesting. I think it certainly has helped for people to understand the implications of the kinds of services that are being provided. I think the research has helped, certainly in terms of improving the targeting of resources in social care, helped improve the quality and effectiveness of social care services. So, and also more recently, give people a better understanding of the consequences of using those services, so in terms of outcomes especially. Well, I would say that we are now much better at engaging with practice and policymakers as well. So a lot more of the work involves closer working with or co-production with either practitioners or service users. So I think that's been a pretty significant change over the years. I think we're also pretty good at, or now have got better at trying to engage with people in terms of the results of our research and knowledge exchange, those sorts of things. So. Funding reform is something that I've been working on quite a lot. So, so some form of more comprehensive funding system for social care would probably be my key one, and that could be some form of insurance system or more universal funding system. When we did the Wanless Social Care Review, we recommended a partnership model, which is a model where there's a combination of public and private funding on a sliding scale. So that's certainly one thing I would look at. And then perhaps in other areas, I'd like to see a lot more focus on outcomes when looking at regulation and issues around commissioning as well. I think that would be a very good thing for services and ultimately for the people using services. Well, I'd like to do a lot more work on trying to understand what the value of social care is to society. There's been quite a lot of work in the past about looking at how to pay for social care, so the funding reform stuff I've talked about. But I think a lot of it has slightly sidestepped more fundamental question about how much we're willing to pay for or value social care. So I think that's where I would invest in terms of research priorities. Quality is an issue, I think, and getting the right balance between cost and quality, I think, is going to be pretty important. Funding, of course, as well, that's a crucial area. The economic situation obviously is not very permissive at the moment in that regard, so that's going to be an issue, and that will remain an issue for a while. And then on the organisational side, there's going to be some big issues around health and social care integration, the governance of social care and how it works with healthcare. So I think those are some key areas. I've never been very good with the whole crystal ball thing. I mean, I think in some ways I'm confident because there has been a much greater priority given to social care. So as a policy priority on the policy agenda, people's awareness of the issues around social care, those have improved quite a lot recently, and certainly in the last 5 and 10 years, I'd say it's really moved up the political agenda. So that should, in the long run, come with, I guess, more funding and more of a focus on quality. But there are also reasons to be pessimistic as well, because there are still some issues around quality and around funding that need to be addressed. So I would say a pretty balanced 6, maybe, something like that. But there's always a bit more nuance than just a 1 to 10 answer.